Hello. We know that duodenal eosinophilia, increased eosinophils in the duodenum, is strongly associated with functional dyspepsia, and this work has been confirmed by several centres. We also know that there are some people without symptoms who also have increased duodenal eosinophils. Further, it's been shown that functional dyspepsia is strongly linked to anxiety in a number of studies. But what is not known is whether duodenal inflammation is a predictor of the development of anxiety. So we set out in a prospective study done in Sweden to answer the question, is duodenal eosinophilia a risk factor for anxiety at follow-up? We followed a cohort from a random population sample who were endoscoped. We followed this cohort for 10 years, and we, within that cohort, conducted a nested case control study of subjects with functional dyspepsia and healthy controls. We had 89 FD subjects and 124 healthy controls. And we measured anxiety at baseline and at follow-up, as well as potential confounding factors in the study. The bottom line is we found a 4.5-fold increased risk of anxiety at follow-up in those who had duodenal eosinophilia at baseline, regardless of functional dyspepsia status. This therefore appeared to be unlikely to be driven just by having functional dyspepsia, and we concluded that duodenal eosinophilia may be a risk factor for the development of anxiety. The first time we believe this has been shown in a human study, and therefore this is potentially very exciting. We did look at confounders such as non-steroidal anti-inflammatory drugs, and even adjusting for confounders, this did not seem to explain the associations. So, in summary, increased eosinophils in the duodenum may not only be a driver of functional dyspepsia, but may also potentially be a driver of anxiety.